In this video, you will be learning about depression and suicide prevention. We will address questions like, what kind of long-term help is absolutely useless? What kind of long-term help can be actually harmful? What kind of long-term help is proven to be effective? Is checking in with messages and calls ever enough, or can it be too much? How to best monitor a person's state and do not miss an important moment, like, for example, a suicide attempt. Should you insist to walk this person to therapy sessions to ensure that they're getting better? How to determine boundaries? And is there anything else what is important to know about the maintenance help? This video is a part 4 of a 4-part series, Suicide Prevention, on my channel. An important disclaimer is that suicide can and should be prevented by health professionals. Please visit hospital if you have suicidal intentions or call a hotline in your area. You can find crisis numbers for Finland on the screen and more information in the description for this video. The purpose of this video series is to spread awareness about mental health. What kind of long-term help is absolutely useless? Straight to the point.
Or suicide.
Like
long-term help is useless.
Well, for the helping a person who is suicidal, like a friend.
Right.
If you want to help them.
Okay.
What's useless?
What is useless? Well, I guess doing nothing is useless. Cutting off contact, not talking to them again is useless. Not answering phone calls or text messages. There can be a point at which you might want to set some boundaries, so we can talk about that later. But it can be, I guess, useless to kind of withdraw and not be there for that person.
And what kind of long-term help can be actually harmful?
So I think what would be harmful would be encouraging them to maybe drink a lot of alcohol to forget their problems. Because we know that actually over time alcohol can increase your depression. Drugs could be a similar story. It could be harmful for a friend to, tell them, okay, just forget about it, or like I said, dismiss or minimize their suicidal thoughts or their depression. It could be harmful if you don't take it seriously. It can also be harmful if you join in too much in talking about that person's problems and agree with them and list all their problems. Often for depressed people, if they sit and list all the things that are going wrong because they have a feeling of hopelessness and worthlessness and guilt and lack of pleasure, they just think of the negative things, and if you join in on that, it can make things worse.
What kind of long-term help is proven to be effective?
Right. So I guess from a friendship point of view, it would be effective if you joined in doing positive, pleasant activities with your friend and being in contact and maintaining a relationship with them. If you're talking about professional help, effective treatment is usually, for severe depression, it's usually a combination of some medication, like some antidepressants or other types of treatment, and a therapy, like a talking therapy. So some kind of psychology or counseling where you have a person who is encouraging and supportive and helping you to get out of the cycle of depression. And the type of therapy that can work best can be therapies that look at, changing your behavior. So maybe cognitive behavioral therapies, or it could be therapies that look at your interpersonal relationships. So maybe you're getting depressed due to a difficult family relationship or personal relationships. So therapies also that are kind of forward-looking and trying to find a solution often helped people to get out of depression as well.
So is checking in with messages and calls ever enough, or can it be too much?
Okay, that's a good question. So I think checking in with your friend is a good idea. like, I would guess there could be stages. I mean, if they're very suicidal, you might want to be with them or make sure that another person is with them all the time. If they're past that stage, I think checking in with them every day can be good. And it could be too much, I would say, if it's, taking up more than 20 minutes of your day every day. I think that could be too much. Or if you find every weekend is, many, many hours spent with that person, that can have a really tough impact on the friend. The friend might want to go and get therapy after that.
Yeah. Yeah. How to best monitor a person's state and do not miss an important moment? Like, for example, when they want to commit a suicide.
Yeah, I think the best way is just to ask them. So I think the best thing is to just simply ask them, like, are you feeling suicidal today or this week? So if I have clients who are really suicidal, I will ask them at the beginning of every single session, like, are you feeling suicidal? Have you had suicidal thoughts in the past week? Like, have you got intent, or is it more passive? Have you had self-harm? So I think just straight out asking your friend if you're willing to do that.
That's really cool, because I feel like that's usually the thing people try to avoid, like to ask that.
Yeah, and that's it's a very strange thing, because you can actually just ask people. Like, I have never had a negative reaction from asking people, I can promise. Yeah.
Should you insist to walk this person to therapy sessions to ensure that they're getting better?
Well, I think it depends. Usually in Finland, if you've gotten therapy, you've already gone through quite a few hurdles. Like, you've found a therapist, or you've been to a doctor, or you've been to a nurse. I would help a depressed person with those earlier stages, but it's very unusual for a friend to walk somebody to the therapist's office. I haven't ever seen that, so I wouldn't think it's necessary. I think the person needs to have their own motivation to go to therapy. The best thing you can do is to be a good model and example, and maybe go to therapy yourself, or talk about other people who've gone to therapy who had a good result. So talk about the behavior in a really positive way.
How to determine boundaries, which you mentioned.
Yeah, boundaries. So boundary setting would be a situation where you need to make sure that you can go on living your life and doing things you need to do, like enjoying life, doing practical things, work, family, hobbies, all that. So it's important that you set a boundary so that your help with a depressed person or suicidal person doesn't interfere too much with your life. So it may be that if they are having a crisis, every weekend or every second day, you have to set a boundary, and you may need to do that by saying, I can talk to you on the phone every day for 10 minutes, I'm available, but besides that, I need to get on with my life. Or I can be with you this weekend, but then your other friend or your family member has to be with you next weekend, and so on. So you need to make sure that that you have some boundaries that protect your own personal space, and that allows you to kind of recharge and look after yourself so that you can help the other person.
Okay. And is there anything else what is important to know about the maintenance help?
Like, in therapy, it's usually when the person has reduced their symptoms a lot and they're doing much better, and so you want to maintain that. And I think for friends, it can be useful to know that possibly your friend who's had depression, when they get better, they might be quite a different person. It's good to prepare for that mentally. Sometimes when people are less depressed, the other personality characteristics come through. They might be more active, they might be more angry, they might talk more. That can be a really strange shift in the dynamic for friendships and relationships. So be prepared for that.
That's interesting. I never thought about that before.
Yeah.
Okay. Thank you so much for answering these questions and coming, participating in these videos and answering our... Oh my gosh.
My pleasure. My pleasure, Anastasia. It's really lovely to be here. Thank you for inviting me.
Would you like to tell a little bit more about yourself?
Yeah, sure. So I'm a psychologist, a clinical psychologist. I'm registered psychologist in Finland and also in Australia, where I'm from. And I am working here in Helsinki in a private practice called Campus Psychology. I'm also in an organization called Psychological Practitioners Finland, and we are setting up a website called mentalhealth.fi, which has information on where to seek help if you have a friend who's suicidal or if you need to get help yourself. Yeah. So thank you very much for having me here to talk. And if you need more information, you can go to the website.
Thank you everyone for watching this video, and you can check the previous videos of this series about depression and suicide. And if you made it this far,
subscribe.
See you. Bye bye.
Bye bye.